I'm Lisa Hucker. I'm one of the advanced practitioners in the family front door, and alongside me I've got Andrew Carter, who is one of the family front door practitioners. So just to give you a quick whistle-stop tour in terms of the family front door. So I work as part of the daytime team, and I work alongside social workers within the team, including advanced practitioners and family front door practitioners, Andy being one of them. We've got 5 team managers, which is overseen by an operations manager, and the family front door are based at Bridgewater Police Station, and that's Express Park, and we sit alongside the police and safeguarding health teams, and these statutory agencies are part of the multi-agency safeguarding hub. We've got Somerset Direct team. They're based in County Hall, and they are our call centre that's made up of customer service specialists and advisors who input the data onto our electronic system before it's passed through to our team. We've also got our emergency duty team, so they work out of hours, and they consist of 4 advanced practitioners and 5 senior social work assistants, and they're managed by the EDT team manager. Thanks, Andy. So our key responsibilities and functions at the family front door. So social workers and advanced practitioners, we manage and review the risk for level 4, that's acute referrals, both at child protection and child in need level. So the general role of a social worker within the team is to respond to information received and make inquiries to inform a decision around threshold application. So when an early help assessment is submitted, we will review the information in a timely manner to look at what support is best needs within the family. So this will normally be in conjunction through triangulated information with partner agencies, the family, and where appropriate the child. So the social worker making these inquiries will risk assess the information and will analyse and make recommendations about further support for the family, and that will then lead to an outcome of no further action being taken. For example, a conversation with the family could take place and we feel that no further support is required. It's quite an unusual situation. We can think about referral to our early help service. With consent from parents and carers, we can look at stepping down for support from our family intervention service, or we can make the recommendation with consent from families for a children and families assessment to take place. We also, where there's an immediate concern for the welfare of a child, we could consider holding a strategy meeting. We also have, as part of the function of the family front door, the multi-agency safeguarding team with the police and health colleagues, and we have a multi-agency safeguarding meeting that takes place daily, so that could be part of the outcome of that early help assessment. And once a decision's been made by a social worker, we'll feedback the recommendation to the requester. Thank you, Andy.
Lovely. So I'll take over and just give you a quick heads up about the Early Help Hub, which is part of that family front door. It consists of myself and 4 colleagues who are our family front door practitioners. Hopefully some of you will have heard of the hub and heard of the support that we can be. We have several roles within the team. The primary one is that we triage for the family intervention service. So anything that comes through via an early help assessment, police report, ambulance report, and anything like that will come through to us, and we will complete that triage much in the way that Lisa has just described, in terms of liaising with partner agencies, liaising with the family, speaking with as many people as we possibly can to build a big picture of everything that's going on for the family, so that we can make an appropriate recommendation for what sort of support we feel is best for that family at that time. We manage duty matters in real time as well, alongside our FIS duty team, which I know will be discussed and spoken about later, but it's one of the functions as a first port of contact that sometimes things will come through to us, and we can arrange and support that sort of support if it's recommended and needed. We work very, very closely with Lisa's team with the social workers that work as part of that first response side of the family front door, so that we can make sure we're being really consistent in everything that we determine, and that we're considering every possibility in terms of the support that a family may need and what might be best for them. The last thing that we do, and the last role that we have, is that we deliver training. So we will go out to anyone and everyone that will have us and deliver as much as we can to try and make sure that, with the best will possible, everyone out there in the team and that forms part of the partnership has the best advice and the best guidance that they possibly can to make sure that they're giving effective support for the family, which will in turn mean that effective support for themselves and the best outcomes for families moving forwards.
Thank you, Andy. So we've got key roles within the two teams in the family front door. So we've got duty team manager and a backup duty manager. So they've got the management of oversight on all early help assessments that come in, referrals sent, that's both acute and complex needs. They have the responsibility of having consultations with the social workers, with the family front door practitioners. They allocate all work and do all authorisation. So any decision that is made within both the family front door, that's both within the early help hub and first response team. Managers have oversight in terms of what that decision has been made. They have the management of strategy meetings and responding to urgent safeguarding matters and chairing the multi-agency safeguarding hub meetings. And then we have a duty social worker who responds to all safeguarding calls which require an immediate response, and they should come through Somerset Direct. And then we've got backup duty social worker that offers the primary support to the duty social worker in responding to safeguarding calls. We have a designated members of the public line. So anybody in the general public that has a concern for a child and wishes to seek some advice, some guidance, or make a referral to children's social care, we have a social worker that sits on that line. That comes through Somerset Direct, and we like to take these calls in live time where possible. That line can get incredibly busy, so Somerset Direct will advise that member of the public if they're happy to leave their details that a call from a social worker may be made back just to gather some further information. We've also got the designated safeguarding leads consultation line, which has recently changed. So we used to have an early help hub consultation line as well as a first response consultation line. We've now merged the two. So any consultations via this line, whether that's a complex need or at acute level, needs to come through that one designated line, which I've put there on the presentation. That line is for designated safeguarding leads to have a case consultation and consider threshold application. We do ask that the case summary that you're going to provide while speaking with the social worker on that line remains anonymous, and there is no formal recordings at the point of that case consultation. But social workers there to be able to support practitioners in thinking about that threshold application and where best the early help assessment needs to be submitted, whether that's acute or complex. We also then have a duty family front door practitioner, and they are responding to and arranging appropriate support for urgent duty matters where complex need has been identified. So in making a referral to children's social care, if the concerns are not immediate, professionals will be asked to complete an early help assessment, and on the last page I've put a link to Professional Choices website where you can find that referral form. Consent must be gained from a family that you're referring on an early help assessment, and request the involvement. So this early help assessment can be used to request involvement for many services identified through Professional Choices, and is also used at the family front door, requesting involvement by both children's social care and the early help family intervention service. Professionals are required to state whether that's acute or complex on the early help assessment, and to give clear reason as to why consent is not obtained. And that will often, a discussion will need to take place if consent, it does come in without consent from the family, unless there's clear understanding as to why that is. If a professional has an immediate safeguarding concerns regarding the safety and well-being of a child, they should contact Somerset Direct, and then they'll be passed through to a duty social worker where they can discuss their concerns. If it is a duty matter, we would say that we would take that information in live time so we can respond in an urgent a timely way to them concerns, but we do ask that an early help assessment is completed and followed up within 24 hours and sent through to us.